Hey y'all, hey, what's good? This is your girl, Kamika, coming to you live from What's Good from the desk of the therapist. Man, you all, I have a treat in store for you today, and this is nothing short of amazing. In just a moment, I'm going to be joined on stage by an amazing woman that I have been blessed to cross paths with. And so without further ado, I'm going to ask my guest if she would be kind enough to join me on stage and introduce herself.
What's good, y'all? I am Dr. Brooke Scott. I am a general dentist here in Indianapolis. Born in Indianapolis, raised Fishers, Indiana. I went down to South Carolina for college, went to South Carolina State, made my way back here for dental school, and then I ended up staying here working with my family's practice, and now I am one of the owners of my family's practice. So it's been quite a journey. Dentistry is definitely my thing, but I will say prior to dentistry, I was a cosmetologist. And I catered a lot to, mainly I went into cosmetology just because I was very tender-headed growing up and I still needed my hair done. And so I wouldn't let anyone do my hair. So I had to figure it out myself. And so I've always been known to have like gentle hands when it comes to doing hair. And so that is also what I'm incorporating into being a dentist and just like being gentle. So with, both of my careers, just knowing how to use my hands to care for people in ways that may not always be comfortable. So, yeah.
Awesome. Well, congratulations. And I'm super excited, sending you lots of love, positive vibes and positive energy. But I feel honored. I just want to tell you, I think very highly of you. I have nothing but great respect and admiration. And just thinking that you would take time to bless the podcast and come and spend time with your girl. I'm truly honored. So thank you. I appreciate you. I want to ask you though, so you mentioned briefly just the history of family dentists, right? Who started it, and then how do we get where we are? And then we're going to get straight into our topic for today.
Yeah, for sure. So Scott Dentistry was founded by my grandfather, Dr. Leonard Scott, also known as Bishop Leonard Scott. And he actually got into dentistry. His passion was music. It had always been music. But his parents, pretty much was like, music may not get you to the money. And so he made a deal with his dad, and his dad was like, if you don't, sign a deal or whatever in the next year, then you're going to dental school. And he just knew he was about to sign a deal. Didn't happen, went to dental school. And that is crazy because that's how his journey of dentistry began. And, like 30 years later, maybe 35 years later, my aunt joined. So Dr. Lena is his daughter. And so she joins the practice, and then here about another 15 years later, I join as the third generation. And it's just amazing because now my granddad is able to retire, and guess what? He's a signed musical artist, which is what he wanted back when he was a teenager, right? So it's just crazy. So now we have this legacy in our family. My younger sister is a second year. Oh my goodness, she's a second year in dental school. And so I also have a cousin who's in dental school. It's just continuing in the family. I don't know. God has blessed us. We're definitely not telling each other you have to be a dentist. So I don't know. Yeah.
I love it. Now, real quick, where can we find you? I usually say this for the end of the podcast, but since we're in the thick of it, where can we find you?
We are located on 71st in Benford. So it's just south of Castleton. Address is 5501 East 71st Street. We are unit number 3. It is called Scott Dentistry. You could also call to schedule appointments, 317-257-2688.
Awesome. Now let me ask you, what's your specialty? Is there a specialty?
Right. So no, it's a general dental office, but I don't have a specialty, but like I said, I'm geared towards like relaxation and comfort in dentistry. So we are now incorporating spa aspects. So I wouldn't call that a specialty, but just gearing the office to relaxation. So having the TVs, getting some paint on the wall, having it look like a nice relaxed and sophisticated atmosphere, so patients can come in and at least feel that when they come in. And then offering services like facials or just things where they're able to just kind of lean back and also enjoy being at the dental office. And honestly, just being able to gain more trust in my patients with that. So it doesn't just feel like this is a doctor and I'm their patient, but you can also come to us and get other services done that you're not terrified of. So,
Yes.
yeah.
Yes. Now that's a perfect segue, right? That's a perfect
Yes.
segue. But I want to just give a shout out to my dentist, the one, the only, Dr. Brooke in the house. Hey! Because y'all, she keeps your girl together, honey. And I be in there stressing her out. I know I be in there stressing her out. Like, can't we, this tooth, that one, to the left, to the right, to the bottom, to the top? She like, girl, you're fine.
And you have such a beautiful smile.
Well, because of my dentist, so thank you. Shout out to my dentist. But I heard you mention a little bit about, anxiety. And today's topic is mental health and the impact that it has on dental hygiene. And so when we think about anxiety specifically, that is one of the diagnoses that we often see clients for in therapy. And you can have patients, that come to your office who have anxiety or not want to come to the dentist because of anxiety. Talk a little bit about the correlation between mental health and dental, oral hygiene.
So I would say the biggest thing would probably be, I think more so, I would say depression related to oral hygiene. And so, in two ways. So one way where when you are depressed, you find yourself doing things like not having the energy to want to shower or to brush your teeth. I know some people, when they're depressed, they may actually feel like they're going to gag if they try to brush their teeth and they don't want to eat things, or people who begin to binge things. So maybe it's television and sweets. And so now you're incorporating no longer brushing your teeth, but also eating a lot of sweets, right? And so things can begin to degenerate very quickly. And so you have to remind yourself when you're in those periods of depression to continue to take care of your body and, your oral health as well, because how quickly things can decline. And it really starts with that state of mind that you're in. But then from an aspect of insecurities, so not having that smile, being embarrassed to open your mouth and speak to someone because maybe there's a missing tooth or there's a dark tooth or maybe there's bad breath. And so, you may on the outside be like the most beautiful person, but because you're insecure about when you open your mouth, now I'm anxious around people. I don't want to speak, or it's making me be very insecure. And so I would say that in a big way ties into mental health.
No, absolutely. Absolutely.
Yeah.
So what do you say to someone who has that anxiety about coming to the dentist office? Just take a moment to say something to encourage them or reassure them that it's going to be okay. I got you.
Yeah, for sure. I would say, find the perfect dentist for you. I would hope that it's me. If it's not, whoever that person is, make sure you're comfortable where you're at, especially if there is dental fear involved. And it's okay to shop around and find a good dentist, just like you would a therapist. And I know that sounds crazy, but it's important. And it all starts with an exam, so just at least go get an exam, figure out what's going on. And if nothing else, take care of the decay, things that could continue to worsen your overall health. Like, I don't think people realize how much oral health is related to your overall health and like other system. I'm sorry, there's a spider. Woo! Okay. Sorry. So yes, other systemic diseases that can be related to neglecting your oral health. So, even if you're not ready to get anything done, come talk to us. Come get in the office, have a conversation, get to know who we are, get a cleaning. We won't force treatment on you, but at least have an idea of where you're at. And then if you come in and you don't need treatment, a lot of people, we got some new comfortable chairs. So sometimes a dental cleaning can feel very relaxing, so come and get a nice gentle cleaning, a little polishing. Look at it as a spa day, and incorporate one of our little spa treatments. Get in for a facial afterwards. Yeah.
You know what? It's funny that you say that, because there is a list of services that you are now providing through what we call the spa treatment, which
Yes.
is absolutely amazing. But I also just think about dental hygiene as a form of self-care. It's just self-care.
Yep.
It's just self-care. So in therapy, when I'm dealing with clients who are frustrated or, have depression, as you mentioned, whatever their diagnosis is, they go through a series of highs and lows as it pertains to stress and anxiety. So to your point, if the process entails, you got to come to your therapist first so that we can address, the anxiety that you're experiencing to help you then take care of yourself. But to Dr. Brooks' point, when you look better, you feel better, right? So just taking that initiative to be able to do that for yourself. So briefly mentioned the spa cleaning, but I'm going to give a shout out to you because whitening is my thing. Hey, the girl is. I told Dr. Brooke I want my teeth to glow in the dark. They got to glow in the dark, honey. If they're not glowing, if I don't have Lady Goater
and
teeth,
look, they're glowing.
Because her teeth showing up glow in the dark.
Right. The model of all teeth.
Yes. No, seriously. Yeah. But I just want to thank you because your staff has been nothing short of professional, friendly, courteous. When I walk in, and I know there's some stereotypes or hesitations or myths around some businesses, but that has not ever been my experience with your office. And so, job well done to you and your team for the level of professionalism that they come. Is very warm and welcoming environment, and it just feels good to be there. So anyone who is just dealing with struggles and concerns as it pertains to going to the dentist or taking care of your oral hygiene, I'm putting in a shameless plug for my girl because they will take care of you. They will get you all the way together, and patients in network, out of network, right? Billing as it pertains to that.
Mm-hmm. Yes, ma'am. Yep.
And you also accept care credit?
Yes. Yep. So we're in network with Cigna Delta Dental. We do not accept like Medicare, Medicaid, but we do work with out of network patients as well. Yep. Cash, care credit. Yeah.
All of the above.
Yeah.
Awesome. Well, just one more time, just take a moment to encourage someone who, again, maybe have a child who, what are the warning signs that maybe a parent should look for in a child that may be possibly having some challenges in the area of, just healthy oral hygiene habits. What would you say to that parent to encourage their child to just ease some of that transition for them?
I would say first thing is you should be at least trying to bring your child in by the time they have their first tooth or their first birthday, whichever comes first. And so that helps with when they get to these ages of teenagers where they're actually probably starting to experience a little more like hormonal effects and maybe beginning to neglect themselves more. They've already, gotten used to talking to this professional about what their oral health should be, and then coming in regularly to see that professional to be updated. But as a parent, if you're noticing, usually in teens and kids, you can see it build up quite a bit, right? So if you're seeing that, encourage them like, hey, go ahead and brush your teeth, and don't, not from an aspect of shaming them like, oh, you look like this, or people gonna talk about you, your breath stinks, but just like, hey, you want to take care of that for your health, because this could lead to congestive heart failure, and too much sweets can lead to diabetes or your teeth falling out, that type of understanding of, what could happen if they're not doing what they're supposed to do properly.
Absolutely. So that's good. Word to the wise. Now, are you open or do you currently have any partnerships with schools? Because I know a lot of schools, they do that maybe annual oral hygiene check or a vision check. I see sometimes, like, are you open to partnerships with anyone? And what may that look like for you if that's even an opportunity?
I'm not sure about partnerships. We've talked to different schools just about the opportunity of us coming in and like doing exams, or that was a B. That's I was like, oh no. But so it just depends. Different schools have different needs. So some will look for like sponsorships and then say that they will put out a ad or something for us, just so that their students and their families are coming to us. But for us, it's more of a thing being able to give these services to the children. And so we do have an event. We have Give Kids a Smile every summer, where we see kids who may not have access to care. Maybe they don't have dental insurance or they have Medicaid, but their parents would like for them to see us. So we do free exams and cleanings, sometimes placing sealants on those kids during the summertime. But if we're not able to see them, we encourage them to see a dentist who does provide for Medicaid patients, or even going to the health center. They have dentists there. But there's other options for sure. Now, I'm not against partnering with schools. It just is hard as far as what that would look like, because our hours are similar to the school hours. So, okay, are we coming in on weekends, or like, what does this actually look like? Is there a camp? So that is something different. I do partner with schools for camp, so high schools and colleges, where I talk to the health professions, the kids who are interested in health professions. And so talk to them about dentistry, do a hands-on activity. So we have those type of partnerships, but not so much where we're partnering with schools to do like free treatment.
Awesome.
Yeah, this B is gonna be it's an MVP in this video, okay?
Okay, Laz, as we get ready to transition, because I know he out there tearing you up. Before we get ready to transition, if there is someone who's interested in pursuing this career, right, dental hygienist or becoming a DDS, what would you say to them to encourage them? And then also, are you open to mentorship opportunities, or do you know of opportunities for them to get mentorship?
Yeah. So I would say, if you're genuinely interested, shadow. Go shadow, make sure you're interested, do some research, see what it's going to take. And then once you know it's what you want to do, just do it. Like, literally get your foot in the door and do it. But you have to start with shadowing. You can't get to dental school and then realize that you hate saliva or you can't do blood, like it's a journey. So get and actually see what we do on a daily basis. And don't think you can just get into dentistry because you want to make a lot of money. It's an option, but it also takes a lot of money to get there. So keep that in mind. And I love mentorship. I have mentees. I allow whoever to come in and shadow. I just request that they call the office and set up a time, just so we can kind of spread it out when people are coming in. But yes, you can find me on Facebook under Brooke Scott. Add me on Facebook, DM me if you're interested in shadowing. Call the office and request to just like leave your name and phone number, say that you're interested in mentorship or something like that. I'll call you back. But yeah, I love that. That's my baby in general. Love mentorship. So reach out to me if you have any interest in dentistry or cosmetology or being a boss and owning a business, because I'm getting, I'm starting to know a little bit about that too. So yeah.
I love it. Okay, girl, we're gonna wrap it up so you can get away from this B. But if you would be so kind and give your affirmations for me, just affirm yourself. And then I want to talk just briefly, just share a little bit about the podcast that you have, but be kind enough to give your affirmation and share about the podcast.
Yes. So my affirmations, I am worthy. I am loved. Other people's opinions of me do not matter. I am doing the work that God has called me to do. I am beautiful and I am a boss. Yeah. And it's so funny that you mentioned the podcast, because God's been talking to me. But me and my sister have a podcast called Walk It Like Christ Talks It. And we haven't released the episode in a while, but I need to go ahead and record one. And I'm like, I'm gonna go and be someone else's guest. And I still have not, I know, God, I hear you. Come on. So yes, but we do currently have a whole season out, about 10 episodes, and then a couple episodes of a new season. And it's just Christ talk, just talking about trying to be a Christian and live like Christ and in the society, and still, not really being of the world, but still being in the world, and how we're bringing people to Christ and still being able to relate to people. So it's fun, just talking, Yeah.
So where do we find it? I heard the name, but where can we find it?
Yeah, so you can find it on Spotify, on Apple Podcasts, on, I think it's called Podcasters. I think really just any platform where you can listen to podcasts. And yep, Walk It Like Christ Talks It.
Oh, awesome. Well, girl, we're going to be tuned in and tapped in so we can learn how to walk it like Christ talks it, okay?
Yes, ma'am. Thank you.
I want to thank you so much for your time today. If you're get away from the bee, have an
And
amazing day, and I love you, and I will see you soon. You know I will in real
yes,
life.
thank you. Love you.
Oh my goodness, wasn't that absolutely amazing? That's my girl, my dentist, the one, the only, Dr. Brooke, coming to us, talking to us a little bit about oral hygiene and how it affects your mental health. You all, please take a moment to take care of yourself. It's important. What you do matters, and you can't love anyone first before you love yourself. You have to love yourself, and part of doing that is taking care of yourself holistically. Y'all always know what I say. Until next time, please have an amazing day intentionally, and let's get it. Let's grow. I'll talk to you soon. Bye.